Good morning, good evening, good afternoon to our global audience. It is my pleasure we actually have Amit back for after his world travels, joining us for our podcast. And it is our pleasure to have Amy Zolotow in conversation with us today about responsible AI. She brings a deep understanding of what responsible AI looks like. Amy is an executive health leader dedicated to ensuring that AI and digital transformation enhance, not replace, the human experience, something we talk about pretty often in our podcast. She has expertise in healthcare operations, innovation strategy, and human behavior, and specializes in aligning emerging technologies with both organizational goals and the realities of patient care. With an innate ability to understand the big picture while executing at the granular level, she has spent over a decade leading initiatives and driving transformational change across prominent institutions and companies such as Johns Hopkins Medical International, Johns Hopkins Hospital, Mercy Personal Physicians, and SynthMinds AI. Her career has progressively been marked by a relentless pursuit of solutions that challenge the status quo, blending deep operational experience with a forward thinking approach to shaping the future of medicine. She currently serves as a senior fellow for the Collaborative Health Systems Innovation at the Thomas F. First Junior College of Medicine at Belmont University, co-founder of Quantum She, executive advisor, strategic partnerships at Prognosys, and healthcare advisor at Scale Health. Amy thrives in complexity, bringing clarity and purpose to dynamic matrix healthcare environments, and her work explores the nexus of AI, health system science, and human-centered design, focusing on ethical adoption, workforce readiness, education, and the operational impact of digital transformation. She's a firm believer in the power of connection and fosters a shared language, community building, and trust in innovation. We are immensely honored to have Amy here today and to share her expertise with us. Thank you, Amy, for taking the time to join us, and welcome.
Oh, thank you so much for having me. I'm excited for this conversation.
Well, I'm going to kick us off here, and we'll just dive right into it. Let's define what responsible AI is and what it means to you, and how it differs from the general AI development. And I think this is a very important topic. We've talked about ethical AI, which I think is probably a subset of it. But tell us your viewpoint in this space.
Oh, thank you. In when we think about responsible AI, I think oftentimes, to your point, we're thinking about it as this like checklist of ethics, right? But really, responsible AI to me, it's a fundamental shift in our orientation, right? This commitment to, beyond all the capabilities that it has, to the consequences of intelligence. Gen AI, development, it focuses on optimization, right? So we're looking at things that are smarter and faster and cheaper. Responsible AI is obsessed with context. And I think this is a really important point to make. It's not asking like, can we? It's asking, should we, and with whom? I like to think of it as this, like almost this teleological engineering where we're designing outcomes that really respect human dignity. And if we really pause to think about it in that way, in that framework, responsible AI is a discipline of social stewardship, right? It's ethics in action. I like to think of it as responsible AI is that umbrella, and it has these underlying driving ethical principles that really give it momentum to move forward.
I love that. And actually, you flipped what I was saying. I thought it was ethics with the responsible, but I would agree with you as you've explained it, because you're right. And I have had this conversation on a larger level as well, but also one-on-one, that we love the efficiency and all the tools that AI can bring us, but you've kind of put it front and center, which is we can, but should we? Right. And so that's a really great question to continue to grapple with as we start implementing some of these tools into practice. Amit, I'll hand it off to you. either the next
So,
question or comment.
yeah, so I guess it's a very good start to a very important topic. And a warm welcome to Amy. Uh, we're talking about responsible AI, and just let's take a little step back. And Deepu and myself, about a year back, and so we kept on speaking about
Mm,
explainable AI and transparent AI
Yeah.
as the most important fundamental pillar in using AI in healthcare. And this was the time when we were talking about generative AI coming into existence, and
mm,
we were trying to understand the potential that it holds in transforming healthcare. So I'm very excited the way you have kind of defined responsible AI, because it does bring in the context of transparency and explainability in the AI as well.
mhm,
Yeah.
Having said that, there is a segment of AI that is not just going to be working as an assistant, but also giving a causal recommendation in healthcare. That's called causal AI as it comes on. That's where the responsibility is very, very important, because the recommendation, because the guidelines that it will show on the clinical decision support system should not just be from the point of view of an assistant or an augmented tool, but also a responsible way of giving a recommendation. So I think that's the segment where your responsible AI come in. So how does this fit in? When you talk about healthcare in one segment, there's also the segment of education. And in medicine, we look at medical education coming under a bigger spectrum. How do you see this coming into the field of medical education, healthcare, and education? Uh, Keeping aside the clinical practice, the diagnosis apart at the moment, but how do you see
mm.
responsible AI coming in medical education?
Yeah. When we're looking at these two areas, healthcare and education, there are a lot of sensitivities that surround these. And these are sectors that traffic this irreversibility, right? Like think about it this way. So you have a misdiagnosis due to a biased algorithm, and that can't be undone. Or, in regards to education, you have a student's mind that's like guided and influenced by AI powered learning systems that really embeds these lifelong trajectories that can't be retracted. So these are very sensitive sectors. And I think of them as these ethical crucibles where the stakes are super high, right? We're looking at people's autonomy, we're looking at their health, and we're really looking at trust, right? That's the word. You hear me talk about this a lot. Um, it's interesting. There was a article that I recently reviewed from Harvard that talked about this idea of future regret minimization. Like, it's a really interesting concept, and I think about this in terms of how we're looking at responsible AI, and it's that kind of mentality that's really we're gonna need that to guide responsible AI in healthcare, designing these systems to avoid the outcomes that society would collectively mourn later. So, this article really dives into a couple different points on how clinical AI needs to be evaluated on the short term, right? Like diagnostic accuracy, but it also needs, we need the ability to look at long term as well, and the ethical impacts long term. This is where my social science background comes into play. We don't want these overlooked biases to become tomorrow's public health crises. So it's so important that we configure our engineering systems with the foresight to prevent these ethical failures from happening. So that history, that these are the ones that like history judges most harshly, right? They're the failures that seem invisible in the moment, but they become painfully clear in hindsight. That's what we don't want. So it's incredibly important that we're establishing this guidance and guardrails now, so we're not looking back in the future and kind of pointing the finger like we shouldn't have done that.
Yeah, Amy, you bring up one of the things that I'm really finding refreshing. And I will admit that as a clinician and as an educator, um, and generally a pessimist, AI has made me a little bit of a forced optimist, because I really do feel that this is really changing our practice, it's changing our learning. But to your point about not having regrets as we look, finding refreshing as a community of those of us who promote generative AI and the use of these tools and the philosophy that goes along with it, is that we're having the conversations about ethics and transparency and bias and sustainability up front. If I think back to some of these more the past inflection points where we have had some regret about these systemic changes that we've made, because we've looked back on them and like, oh yeah, I would have made that decision differently at a systems level. And I love that we're having these conversations up front, and we're saying we need to talk about it now, not like let's implement and then look at it 20 years from now and see what happened. So to that point, I guess one of the questions that I have, are there examples that you can point to in real life where there was lack of responsible AI that led to harm or bias or another aspect of it that you can point us to, so that we are not replicating those mistakes in the future?
Oh yeah, absolutely. I mean, there are a number of them. One of the most poignant ones was back in February of 2025 of this year. And it was published from Stanford's, I want to say it was the Center of Ethics in AI. And so essentially what happened, there was a predictive health risk model used by a major US insurer that systematically downgraded coverage for low-income patients. So it essentially mistaken historical access disparities for clinical risk. So here, harm was the system's architecture. Like, think about that. So the model was trained primarily in historical billing data, which is, as we know, that's a normal way of collecting data. Yeah. So it concluded that the patients from low-income backgrounds required less care. And it's not because they're healthier, it's because they historically received less care.
Less care, yeah.
Yeah, and the model, so let's think about so the model mistook these access barriers, right? Racism, poverty, clinical, deserts for low income need. And I get super passionate about this. You'll hear it in my voice and I'll start talking fast because, there's again, like social science background, like these are the kinds of things that we need to be looking at. So in other words, the sicker you were, if you were poor or marginalized, the more likely the system was to underestimate your need. And then in consequence, it's going to offer you less help, right? So it's this feedback loop of abandonment. And the failure is epistemological, right? It's an impoverished understanding of human lives and histories. And it's baked into the code, right? Like, I think so often we have to, I think it's a good idea to remind ourselves, the bias is never neutral, right? We build systems, if we begin building systems without embedding that historical understanding, without human judgment, without these ethical guardrails, the bias gets accelerated. The AI is innocuous without that human involvement. So we really need to be cognizant of that aspect as we're building these tools.
That's a great example, and I wasn't aware of that. But we've heard, I mean, I think you and I have probably heard at least umpteen algorithms that were trained on data that was biased and found out after the fact. I think back to this one is not a healthcare example, but I think Amazon had something back in 2015, if not earlier than that, where they were screening through resumes had male names and dismissing the female names, and they stopped using the algorithm. But like that tells you that what, to your point, that the human aspect of this is even more important when it comes to healthcare and education. So absolutely, because we cannot allow this technology to once again create more barriers and more crevices for access to care, or whatever the the myriad of issues we have within And I will say you and I in the US health system, but even Amit will say the same in the Indian health system as well. Amit?
So
Yeah.
yeah, so I will just add one point to what Amy said, and I think the way we are now evolving with these models, I think we are all realizing that biases are quite something which is going to exist in any model that comes into the ecosystem, and we have to have a methodology of overcoming these biases. This is quite context to the way we were looking at these algorithms to be trained on an underfit or an overfit data, and we used to just brush it
Mhm.
away. But now we do realize that these biases are going to be there, and that's where the transparency of the model, the explainability of the model comes in, as in the person or the team that's developing the model, till the point it's tested, it's trained, it's tested, and it's deployed in the real world setting, there's going to be multiple layers of biases coming in. But as long as you are deploying those layers of explaining it and creating a transparent methodology in which you have what you have undertaken to overcome that bias, I think that's where the responsible artificial intelligence comes in, that Amy is talking about. So biases are going to be there, and I think now we are not brushing it off. We are quite open about it. We are saying, okay, this model is possibly giving a biased response. Let's build on it. Let's fine tune it. Let's test it on another set of data. Let's do certain categories of validation. And I think that's the best way. That's a responsible way of kind of trying to proceed with the AI. So, Amy, could you tell us here now, for our viewers out there, and we often use the terminology, there has to be a transparent AI, there has to be an explainable AI, and we go back to our developers and saying, hey, is this an explainable model? For our medical professionals, clinicians who are watching this, could you just give us an idea, how does one ensure this transparency, explainability as they go along the way, which are the primary pillars of making it a responsible AI?
Yeah, well, I think it starts with, how we're designing, right? Like transparency and explainability, they need to be designed for human judgment. I talk about this a lot, keeping that human at the center. So what does this mean? This means, layered disclosures, right? So it needs to be intuitive for those that are non-experts, but very rigorous for specialists, right? I think about this idea from MIT. They use the term cognitive fit explanations. So there are these outputs that are tailored to how different audiences decide and reason, right? So when we're talking about that explainability in AI, we're oftentimes thinking about the technical documentation. We're looking at model cards, we're looking at audit trails, we're looking at statistical validations, right? We're looking at all of these things. But this is the thing. Humans don't make decisions by reading a model card, right? We don't. We make decisions through causal reasoning, intuition, trust. Did we get sleep the night before? We make decisions based on very human elements, right?
Recency bias, Amy,
Yeah.
not to, yeah.
Right. Let's think. A doctor doesn't need a 60-page model card, right? They need a causal pathway, right? So, if the patient's race was different, would the prediction change? We need these explanations that are designed to match that decision-making style of the human, right? Meet people where they're at kind of transparency, something that is customized. We need strategically aware communication, right? Going back to that word context, we need that. We need to be able to build that explainability that really kind of provokes that counterfactual thinking.
Absolutely. No, I couldn't agree with you more. And that as you were saying all those things, I'm sitting here thinking, how do I teach that to my students? Right. Because, and even to Amit's point, right? Like, I mean, now we have an understanding, or I will say, I'll speak for myself as someone who is fairly newish to this area, which is understanding overfitting, underfitting, and understanding how models are being built and what we're looking at from a statistical perspective. which is in many ways a little bit easier to teach because those concepts have been there. We just need to translate them into a healthcare setting. But all the things that you have just mentioned that are more, I will say, human-y versus AI, as how do you blend those concepts and have someone who is in school to be a healthcare provider, whether it be a physician or a PA or a nurse, whoever it may be, and then you have to add this additional layer of understanding in clinical decision making, while knowing that it's still very much new and we're still in the, I would say, R&D phases of AI, because a lot of it isn't fully translatable to clinical practice. And I think that's a space that's ripe for all of us to be able to contribute and really learn from each other so that we can better educate that next generation of students who's going to go out and very likely use these algorithms to make clinical decisions, or at least support the clinical decisions that they're making with their patients. I know we've touched on bias, but I was wondering, in terms of other values that we look at in ethics and responsibility, how do you think we can include values of fairness or accountability or inclusivity? I think we touched on inclusivity, but fairness and accountability. How would one go about thinking about those very human values in designing an algorithm or a tool, for that matter?
I mean, these are the big words, right?
Yeah,
They're like the big, heavy words, but they're also the non-negotiable principles.
that's right.
Right? Like, they're guiding our decision making. We have to keep them at the forefront. So if we're looking at fairness, for example, we need to operationalize that in the data collection stage, right? Not after the fact. Accountability, that needs to be built in the deployment pipeline, right? Like, who owns the outcome when the system's wrong? We need that, right? We need to be able to have that accountability, that responsibility. In regards to inclusivity, when I think of inclusivity, that's where we need to inform the design team, the composition itself. So, like, think about it this way: like, whoever codes is who counts, right? Like, so think about that. Like, who codes, who counts? Like, we need to make sure that we're embedding that interdisciplinary approach, right? I talk about that a lot as well. So if your team is lacking that demographic, experiential, epistemic diversity, that we all really need, your system's going to likely misrepresent the world that it's claiming to model, right? It's so incredibly important to have that interdisciplinary approach. I love the work that, have you heard of Inception Health? Have you ever heard it? No. Inception Health, they're like the innovation arm of Freighter Health System in Wisconsin. They're doing some absolutely phenomenal work right now. They are building the operational design and really the culture to empower people to leverage technology to build new healthcare infrastructure. And I love this. The engineering team is really a clinical team that focuses on data as a product. Normally, we don't think of data.
Data is not the product.
Yeah, we think of data. We don't think of it as, the end. We're focused on using data to help build the product, but they're looking at it very differently. They're building this data mesh architecture to make data a first-class citizen in the product life cycle, and that's the measurement of success. Like, this is the kind of thinking that we need when we're looking at how to effectively embed our values like fairness, accountability, inclusivity. Looking at data as a person, imagine that. I mean, how your brain starts to shift in its thinking. And really that's the kind of work that we're seeing out there, particularly that Inception's doing right now, has been phenomenal. And it's I think creating a lot more dialogue and conversation about what things need to look like when we're looking at that umbrella of responsible AI.
It's amazing.
So,
Amazing.
Dipu and Amy, I think I think very well important points that you have made there. Now, let me just shift the focus and give you the perspective that comes up from the part of the world that I exist in, from India, Southeast Asia. So, first, let me contextualize understanding of responsible AI from the places that you come from the United States, where there is an existence of value-based care. And if you have a value based care, you would be primed to provide responsible AI solutions.
Mm.
At the moment, there's something which I see is still lacking. I'm not sure how it is in the Western world, but well, you are explaining the model, you're building the model, but when it comes to continuous evaluation and refinement, I think most of the deployers or most of the developers are falling short because they are not finding the strength to continue the research when they are already intimidated to scale up the solution to make some profits. I think these are real economic challenges. Now, when value based care comes in, as it exists in the Western world, possibly that would be a reward to maintain your scalability of the solution, but at the same time continue the back end R&D to continue
Mm.
the research and the
Mhm.
refinement so that you're able to deliver that responsible AI continuously, not just when you have developed it, but with real time validation, with internal validation, etc. Now, when you contextualize this whole scenario, let's say for the LMIC, the low middle income group countries, let's say the countries like, let's say the most of the African nations or the
Mhm.
Southeast Asian countries, developers at the moment are finding it very difficult to find a scalability in the solution that they're producing because the
Mhm.
concept of value based care does not exist. So there is a toppling in the economy, there's a shift in the economy where you put a lot of money in building the research around it, but you really don't find the scalability to make some profit out of it, and there you go out somewhere from that fine line of continuing that responsible AI solution. So now with this scenario existing, and this is going to be a consistent scenario existing globally, this is not going to be changing because
Yeah.
each region, each demographic region will be having their own needs. And I have personally realized this since I've taken over as the chair of the International Diabetes Federation AI and Technology Committee, where I've
Mm.
been interacting with many people, uh, especially in the LMIC region, who are faced with different challenges of how to deploy AI solution in their country based
Mhm.
on the need gap. So the definition of responsible AI will be different in the different regions of the world. The thought that now comes to our mind is, as clinicians, as educators, as end users, as people who are going to be in the ground zero level using these AI solutions,
Mm.
how do we shape ourselves such that we are still adopting an AI solution that is transparent, that is explainable, that is possibly responsible to the best of its ability, but at the same time providing an opportunity to the developers to scale it, to make some profit out of it so that they can sustain the whole ecosystem out of it. It's a very fine line, and we still don't have the answer,
No.
but at the same time we
Yeah.
still need to have that responsibility coming in and accountability coming in. It's so easy to say that the person who has built the tool or the person who has developed the software is responsible for the outcome in the clinical decision support system, but is it really? Because as end users, it's my responsibility to put the research on it, so I am also a part of that responsible AI ecosystem. As the hospital provider, the individual who is deploying the model to its clinicians is also a part of the responsible AI ecosystem. So how do you see these individual stakeholders owing up for the responsible AI?
Yeah, and you bring up a really good point. I think we have to start by kind of looking outside the box. And instead of just keeping our focus on our roles as validators, like we need to be co-creators, we need to be co-authors. I use that term a lot. I have a writing background. I love writing. And I love that idea of that co-authorship, right? So the domain experts embody this ontological knowledge, right? Think of it like these structures of reality that algorithms otherwise misinterpret. And without it, the algorithms operate in this world of abstraction. It's a world that's like stripped of nuance and context and that lived experience, that lived reality. So a system without a clinician's insight into like an atypical presentation of a disease, or an educator's sensitivity to a cultural learning difference, it's going to hard code ignorance into that precision. That's what we don't want. So the true collaboration, that true community building requires embedding domain experts across the board into almost like these sprint teams that we can make thoughtful and informed decisions. We have to be working alongside each other. I say this all the time, community is everything, particularly in this space. And when it comes to responsible AI, we need to be building as community, which means coming together in that world of inclusivity, right? Bringing different domains together to really identify solutions to these really difficult problems.
One of the things that I've said here, and I've said it in many of the lectures that I've given, is we really need to think about what interdisciplinary collaboration looks like, because it is no longer just interdisciplinary collaboration within health professions and other health professions, pharmacists and nurses and social workers. And we really need to think of our computer engineers and scientists and data scientists and analysts as part of our interdisciplinary teams. And to Amit's point, as you were explaining this shift or the differences between the areas of the globe of how healthcare is either received, perceived, or given or delivered. One of the things that I was thinking was we really need to come up with a very different system that involves these tools and technology so that we can deliver the care. I think the system we have currently in place across the globe, whatever it may be in your neck of the woods, so to speak, it's not working for everyone. And we often have said we think that AI and the technological tools are going to democratize access to care, but that's only if we let it, and we build the systems that allow us to do that. Because and that is where I think partnerships between private and government sectors need to come together and see healthcare as a right and as a service that we provide to all citizens, no matter what country you live in. And then it takes away, not that, because I can imagine, to Amit's point, of the person who created the algorithm to deliver it wants to make some money off of it, obviously. But at some point, we have to say, you know what, this is in service of the greater good, the greater delivery of care. And I remember, I think of all the public health lessons that we've learned as a globe. And the one right now that comes to mind are obvious vaccines that have been kind of given to the world, but even more recent ones like seatbelts. The technology around seatbelts was created by Volvo, and the guy who created the actual mechanism of the seatbelt and studied it, and Volvo donated it to the world. So they didn't gain anything from it, but they gained the fact that they saved millions of lives since the inception of it. And so we need to find that balance. I'm not sure what that is at this point. Obviously, that will evolve as we all learn more and more. But there needs to be a balance of, I'm going to make some money off of this, but I also want to do good. And what does that look like? And it'll take all of us to look at a system very differently.
Absolutely.
Yeah. One of the things that I think about as we move forward, and I mentioned this earlier, is how do I educate the next generation? How do I find that balance? And if you were to give us some tips or pearls, Amy, on frameworks to think about, tools or certifications that our listeners could use, or even how to evaluate AI being used responsibly. It's one thing to say it; it's one thing to it's another thing to practice it in real life, and then perhaps even planting the seeds of these conversations so that when a student graduates, they're able to ask the right questions. I often will say to my students, I don't need you to be an AI expert. Your patient doesn't need you to be an AI expert. What your patient needs is, are you able to ask the right questions, so that because you have an understanding of how you're applying that particular tool or algorithm to the patient.
Yeah, absolutely. I've got a few different takes on this. I think when we're looking at frameworks and tools, certifications, all the things, I'd like to point the audience in a few different directions. So responsible AI lifecycle. So there's a rail framework formalized by the Global Institute for AI Responsibility. That was back in March. It's essential. So it really demands this like third-party auditing system at critical lifestyle junctures like design and data deployment drift. And it's really a hard reset on accountability, on really the accountability is embedded into AI development. So it really demands this independent third-party audit. We need to make sure that we have these checks and balances in place. So yeah, we're looking at design. Does the systems architecture does it really reflect our human values? In terms of data, is the training data representative? And is it ethically and subject to bias, stress testing? When it comes to deployment, how is the system behaving, under real world conditions? And drift, when we talk about drift, as our environments and our populations and our behaviors change, does the system still uphold the original fairness and safety commitments? Like, these are incredible focus areas that we need to be thinking about. And really what I like, each checkpoint really forces teams to demonstrate, with evidence, real world consequences of technology, which is what we need to be focused on. Regarding tools, I'd like to think about the bias benchmarking suite. I always flub when I pronounce it. And it's from Carnegie Mellon. It's the gold standard for model stress testing. So unlike these earlier tools that they only flagged for, statistical disparities. So this suite, it really forces teams to confront these causal pathways of harm. So, where does bias emerge? Right?
Mm-hmm.
When it amplifies, who disproportionately it impacts. Bias in relation to this suite, it becomes something that's quantifiable and accountable. Regarding certifications, I think about the Fairness, Accountability, and Transparency Seal.
Yeah.
It's called FATS. Yeah.
Yep.
And that's becoming a credibility filter, right? Really.
Mm-hmm.
So especially in sensitive sectors like, health tech and ed tech, we've got investors and customers and regulators, all of these people now demanding this verifiable evidence that AI systems they're not just legal, but they're legitimate. There's a difference there.
Yeah.
So it's requiring this documentation of, fairness testing, these open audit records, user impact reports. Really, they're looking at evidence that is inclusive of design practices. So these are just some areas that I like to refer to that people might benefit from.
That's great, Amy. Before we go into some questions from our audience, I want your thoughts on what is the one thing in this space that we're not talking about enough when it comes to responsible AI?
Epistemic humility.
True.
I love
And I'll
that. Please explain. I love it. I love it. Please
so
explain.
too much responsible AI discourse, like what we're all talking about, it's assuming that if we just get better data and we just get more diverse teams and we just get more audits, we're going to solve bias. Like we're just going to solve it completely. But here's the thing, human societies, they're dynamic and they're pluralistic and they're contested and they move and they change. And no AI system is ever going to be perfectly fair across all lenses. We talked about this earlier, right? And what we need to be doing is really embracing that continual recalibration and that really profound ongoing community dialogue and that system malleability, right, as core features of this. We're not looking for closure with responsible AI. We're looking for more of a perpetual responsiveness.
Right.
Well
We're
said.
yeah, and it's
Yeah.
I think so often I engage with people, and I think there's a moment of questioning that we're facing now. I think we've been talking about that. Like we're looking to question things. We're moving into the space of how we question, and that really is a reflection of the humility of the consequences of not knowing what we don't know. Right. The work. We're not doing this work to make AI flawless,
Yeah.
but what we're doing is we're creating it to make it faithful, right? Like we want to make it faithful to the people and the principles, the processes, the possibilities, that we refuse to abandon as human beings. And I think that's what we need to be focused on.
I love that because you
Yes.
basically what you're saying is that it's not a destination, it's a journey, and it's a journey that won't end.
Mm-hmm.
To
Amit,
add to that
I'll leave
point,
it you.
yeah, to
Yeah,
add to
go
that
ahead.
point, Amy, I mean, that actually takes us to one more leading question. And I think this whole episode of deep discussions is going to be incomplete if you leave this question out. Is that when you talk about setting these guardrails of responsible AI, who should actually be setting these guardrails? This is also a very important question. So, to all our audiences out there, if I could just give you an overview before we go into this context of discussion. So, at the moment, across the globe, we have in the US the FDA, which is quite robust in setting the guardrails of how you should develop, deploy, and have certain categories of validation before your model comes into deployment. While you go to the European Union, the EU Act kind of speaks and advocate more about the segment of ethics, the segment of transparency. It's heavily laden with that. When you come to the subcontinent and India, we are evolving with the Digital Data Protection Act, talking about data interoperability, integration into the workflows, more seamless clinical integration into the workflow of the clinicians, etc. Possibly we are not still in there yet talking about the ethics. So now, when you have these regulators, these policymakers, set in the guardrails of responsibility and how these AI should be governed, how responsible it should be. So, should the responsibility development quotient, or I should say, the putting the guardrail quotient, be only on the regulators and the policymakers? Should it be self-regulated as well? Should there be, now this is a very interesting point I'm putting to you all, that should there be the organizations of clinical bodies having their say in how they want their AI to be used, how they want their data to be used, and what kind of AI they want in their clinical practice. What we have at the moment when we talk about responsible AI, Amy and Deepu, think about this. We are looking at the developers putting in their ethical framework, developing it. You have the regulators, the policymakers, the government agencies giving in the guidelines, and that's it. And the end users possibly don't have a say in how much of it should be regulated or how it should be placed in terms of the responsibility. So what are your thoughts on this? And my viewpoint here is very simple, is that I believe that the medical fraternity, the clinical fraternity, the end users, even the patients for that matter, who are going to be the end users, must have a say in how the AI tools must be regulated, must be governed, and possibly that would complete the whole ecosystem of responsible AI. Thoughts and comments?
Mm-hmm. Oh, no, I agree. I mean, our current policies are woefully insufficient. They very much lack the reality on the ground, almost by what, like three product cycles at minimum.
Yeah.
Yet, purely top-down regulation, so that risks, bureaucratic capture or inertia, or we're just not moving at all. So I feel like we need this new moral federalism in AI governance, like almost like, and to your point, like this dynamic interplay of like grassroots community standards. Some of the most beautiful movements can come from like the ground up. We really slice through that disconnect, but also including those very sector specific professional guidelines and those federal guardrails. Like there needs to be a harmonization with all of this, and we're starting to see some pretty powerful groups come together, addressing things as a community. It's interesting because as I look at different sectors and different domains, like I think we have a lot to learn from other spaces. Like Georgetown did a really interesting comparison piece on AI regulation that needs to mimic environmental law. Like, think about that. It's flexible, but it's also enforceable. It's principle driven, but it's also empirically updated. So, like, we have a lot we can learn from some of these other sectors that are doing some phenomenal work. But to your point, I think it's important to have that inclusivity, right? Having the patients involved, these patient advocacy groups can be incredibly powerful in this space. They help us see things from a different perspective. And if there's anything that we need right now, I think, there's a premium in looking at things differently, and we need to focus on that.
100%. Amit, when you were listing all the areas, and I was like, all of the above, and that's true. We need all of these stakeholders to be engaged with us. I think where we are currently is that I don't think all the stakeholders are fully educated enough about the questions that need to be asked in these spaces. And I wholeheartedly agree with you, Amy. We have in healthcare, I always find ourselves kind of trying to reconfigure the same problem in a broken system. And we never look to other industries and other sectors who have solved these problems decades ago when it comes to systems design and systems thinking. Some of it, I think it is warranted and normal. At the end of the day, it's not a robot that we're taking care of, it's a human being. And so to your point, there's a lot of change, and societal change really dictates what we do as patients, as providers taking care of patients. But there are some systemic changes that we should be adopting within our healthcare system that are lessons learned from other sectors that we haven't for whatever reason. And I think that I go back to my earlier point, which is we really just need to think outside the box and build a new system from the ground up. Now, obviously, that's Dipu saying it, and magically, it's not going to happen. Obviously, not. But I think we need someone to be bold enough to say, this system isn't working. We need to come up, and it's not that it's broke. It's just so broken that we cannot build anything, because anything we build on it, the scaffolding was broken already. It's just not going to work. We need to start from scratch. That's a very bold way of thinking, and certainly will take decades of work and building to implement. But I will. We are at time, unfortunately, because I think I could do this for another hour. But I have a question from our audience that I'd love you to close with, Amy. And it says, in a clinical setting, if an AI-based recommendation leads to a patient harm event, how should should responsibility be shared between the clinician, the hospital, and the AI developer?
That's a
Oh,
million-dollar question.
What a
yeah.
loaded question it is.
Oops, I made a mistake.
Right.
Now I need to own it. Who do I need to tell first? So
Right.
I think it goes back to, obviously every system, and we were talking about this earlier, every context, every health system is going to be different. I think, sharing those mistakes is so important, because it opens up further dialogue as to, what we need to be doing next, what we can learn from that. I think that's one thing that we're seeing very clearly now, that this space that we're all navigating through is filled with uncertainty. I speak with a lot of people every week. I feel like that word comes up from them, regardless who I'm talking to, whether it's industry, healthcare, the provider space. That word continues to be brought up. People are scared, but they're also reaching out for guidance and for help. And I think it starts with having the awareness. I know this might sound kind of cheesy, but you want to start with yourself, right? And that humility of not knowing something or potentially making a mistake. Maybe there was oversight, but I think it comes back to working alongside your team, sharing that, making sure that you're sharing it in a constructive way. And this is where the support from senior leadership really comes into play. I strongly vocalize this often. We need to see more of our senior leadership on the ground. Like, we need to just cut through the disconnect, because it's very real and people feel it. And if you're deploying something new and foreign, right? One of the best ways you can show up for your people is by being on the ground and making it a safe space, being in it together. Because everybody has something to learn. Like, I come from the camp of no one's an expert in this space. We're all lifelong learners. That's my own opinion, but I think we all have domain expertise, which is incredibly valuable when it comes to the AI space. We're all learning together. So when you see members of the senior team really, coming to the forefront, coming to the ground level, breaking through those ladders, it sends a message, and people pick up on that. And it's the message of, it's okay. We're in this together. We're learning together, and that creates more of an opportunity to share mistakes, right? And I think that's the kind of dialogue we have now. Whether it's to the question, who do we go to first? So how do we share the information? Again, it's going to be dependent on your system and what makes sense and who's on the team and so forth. But I'd say in general, you want to make sure that you're involving the people that you want to involve your team members, but make it a point to have the senior leadership team really taking an active involvement in that process. Unfortunately, it doesn't happen enough. These are the decision makers, but they're not on the ground understanding the real hardships of implementation, what that looks like.
Yeah.
And so we need to really kind of start tackling that. And it starts by having those really hard conversations. What we don't want is a mistake to happen and no one talks about it, and
Yes.
it's kept quiet, and it only exacerbates, further problems. That's what we don't want. We just have to make sure that we're creating a space and that we're okay ourselves speaking up when we don't know something.
And I will say, just to put a finer point on that, to the person who asked that question, is that my presumption is that we have told the patient, as a provider, that I'm using AI in my decision-making process, and I've informed the patient of that up front, rather than disclosing it after the error was made. And I think that's as a provider, as a healthcare provider, that's my job, to disclose that in full transparency. And I know transparency is becoming almost a triggering word in a lot of spaces, but I think it's a very important when it comes to using these tools. We are at time. Amit, I'll hand it to you for closing.
Yeah, so I think this was a very deep dive discussion, and really a deep dive discussion. A lot of thoughts going in, a lot of viewpoints coming in. Uh, before we give a big thank you to Amy for joining us, here's one small one-liner from me. So over the last, 1 year and a half, we have been speaking about let's put human in the loop. Let's put human in the loop to make AI work in medicine. This is what I'm introducing it today, right? Let's put all the stakeholders in the loop to make
Mhm.
AI responsible. I think this is one line summary of what we spoke about in the last,
That's right.
50 minutes or so. Let's put all the stakeholders in the loop, and only then, possibly only then, we are going to be looking at responsible AI. So, folks, I think that's been a fantastic discussion today. I'm sure this is going to be going worldwide. A lot of people are going to be watching this even later on the MedSynapse platform and YouTube. I will be requesting all our friends back there in India, especially our members from the Doctors AI community, to do watch this. This has been a fantastic discussion. And I think we keep saying at Doctors AI that it's AI by the doctors, for the doctors. But beyond that, it's for the community at large. And we must think at a larger scale to make this work in a responsible way. Amy, thank you very much for joining us today. And as usual, a big thank you to my co host, Dipu, for doing an excellent work in this podcast. Thank you for making this a success. And a big thank you to MedSynapse team for hosting us. So, dear folks, thank you for joining us tonight and today. And we will be back again next month with another exciting episode of the Med AI podcast, Decoding AI in Healthcare. Bye bye.
Thank you,
Bye.
everyone.
Thank
Thank you,
you.
Amy, again.
Thank you.